very delighted to welcome you to the European Management Conference 2022. 25, sorry. It's a great beginning. Let me introduce myself to you, if it's not already dead. I am Catherine Keller, a former hospital director, PhD in health policy and law, and I've very recently completed a 3-year tenure as director of the health management department here in l'École des hautes études en santé publique, EHESP. The conference, as you know, is organized by the European Health Management Association, and this year co-hosted by l'École des hautes études en santé publique, EHESP. This year will mark the 30th anniversary of the EHMA conference, and we are very pleased to welcome you and to welcome the conference once again in France after almost 20 years. During all the conference, I will be your master of ceremony. And without further ado, and to kickstart the conference, let me introduce to you Dr. Anthony Pierry-Grau, who is the president of the board of directors of EHMA, and is running a primary care center in Catalonia in Spain. Please, Anthony, the floor is yours.
Thank you, Catherine. So, hello everyone, good morning. And on behalf of EHMA, welcome, bienvenue. It's a real pleasure to have you all here. As just mentioned by Catherine, this is the 30th conference of the European Health Management Association. But this year, it's a special year, not only because we are in this excellent hall, but because it's the year with more attendance to the conference. We are over 470 participants, and this is going beyond the limits of Europe itself. We are really glad to count on participants coming from all the continents, from Japan, China, Singapore, Indonesia, from Africa, from Egypt, Nigeria, Kenya, from the Emirates, from Arabia, also from Australia, from Canada, from the States. Sorry if I forgot someone, but it's very important. It's very important because it goes directly linked to the motto we took this year for the conference, taking actions to improve health for all. As you are probably aware, we are in a difficult world, in a difficult times, and we are to confront many situations that put health at risk for millions of people. And because of this, we are to develop strategies. We are to work on them, and this is a special moment where we may work on them all together. The challenges are different. The challenges go from, for instance, a shortage of professionals that is really severe in many countries, to the aging. Fortunately, in other countries, the problem is the aging and the non-communicable diseases increase related to this aging. But there may be also some challenges linked, as we suffered 4 years ago, to the pandemic. We are here to look for solutions, and because of that, it's required an innovative thinking and to look for bold solutions. But beyond all this, we are to look for collaboration, and that's why we are all together here. And speaking about all together, I think that as EHMA board president, I'm to thank everyone that attending the conference, but to thank all those organizations that has helped us to get to this point, especially, of course, to the EHSP, called the Santé Publique, to BD, to MSD, to Sanofi, to the European Observatory of Health, to the Mutuelle Nationale des Hospitaliers, to Reliance, to the Région Bretagne, Rennes Métropole, and of course those associations that always go alongside with EHMA, the Karolinska Institute and Eureka. We have 3 days from now on to be inspired. We have poster sessions, oral communications, workshops, discussion panels, and there we are to share our ideas, to confront them, to evolve, because as the motto says, we are to look for action. And this action will not finish after these 3 days. This action is to continue and to look for a better model of health providing, of health working, of research, of industry, to look for a system that's resilient and equitable. We are so to look for action. Thank you, everyone, and go on for this action.
Thank you, Anthony, for this message. The French Minister of Health has sent us a brief video message to wish us a fruitful conference. Let's listen to Monsieur Yannick Neuder.
Monsieur le ministre, cher François Braun, Madame la directrice de l'École des hautes études en santé publique, chère Isabelle Richard, Mesdames et Messieurs, même si je ne peux malheureusement pas être physiquement présent parmi vous aujourd'hui, je suis heureux de m'adresser à vous par l'intermédiaire de cette vidéo à l'occasion de cette 30e édition de la conférence annuelle de l'European Health Management Association. Je veux commencer par souhaiter la bienvenue à tous les responsables managers, chercheurs et décideurs publics venus de toute l'Europe et même au-delà pour ce congrès. Il est d'autant plus important pour moi de vous adresser ce message que ce rendez-vous incontournable de tous les acteurs impliqués dans les questions de gestion en santé a lieu pour la première fois en France. Et pas n'importe où en France, puisque vous avez choisi d'organiser vos rencontres à Rennes, sur le campus de l'École des hautes études en santé publique. Quoi de plus naturel, me direz-vous, en effet, que de rassembler les plus de 450 participants issus de près de 50 pays au cœur de ce qui constitue le grand établissement d'enseignement supérieur de notre pays, entièrement dédié à la santé publique, à l'administration et au management en santé. Le HESP, qui est également à la pointe des travaux scientifiques sur les services et le management en santé, avec une unité de recherche labellisée par l'INSERM, spécifiquement dédiée à ces questions. En tant que ministre de la Santé, en tant qu'ancien chef de pôle de l'hôpital public, je mesure toute l'importance du management à tous les niveaux d'action et de décision du système de santé. C'est pourquoi je suis pleinement mobilisé pour que la France continue d'assurer un véritable leadership sur ces questions et qu'elle participe pleinement avec ses partenaires européens et internationaux à façonner l'avenir du management en santé. En effet, nous sommes confrontés, en France comme ailleurs, à de grands défis en termes de durabilité, d'accessibilité et d'équité des systèmes de soins. Je l'ai toujours dit, je l'ai toujours promu, face à ces défis, la solution réside nécessairement dans une action collective. Il nous faut travailler ensemble dans chaque territoire, dans chaque bassin de vie, dans chaque établissement, dans chaque service, comme de manière interétatique. À toutes ces échelles, j'envisage le management et les stratégies de gestion comme de véritables catalyseurs permettant de favoriser l'émergence de réponses efficaces et pertinentes qui embarquent tous les acteurs dans leur mise en œuvre. Le management et la bonne gestion sont aussi de puissants vecteurs d'efficience. C'est essentiel alors que notre système de santé, vous le savez, fait face à des besoins croissants d'année en année, notamment sous l'effet du vieillissement de la population et de la hausse des maladies chroniques. Le management est aussi naturellement un précieux outil RH. Je tiens à insister sur ce point alors que les mutations du monde professionnel et du rapport au travail transforment profondément le secteur de la santé. La nouvelle génération de professionnels qui s'engagent dans le système aspire à des organisations plus flexibles, plus horizontales. Des organisations où leur voix sera entendue, où ils auront l'opportunité de s'inscrire dans un collectif tout en préservant l'équilibre de leur vie privée. Ce sont des phénomènes majeurs qu'il nous faut prendre en compte de manière prioritaire pour non seulement continuer d'attirer les talents, mais surtout pour les fidéliser et leur offrir la qualité de vie au travail qu'ils méritent. C'est d'ailleurs aussi un enjeu de qualité des soins, puisque plusieurs études ont démontré l'impact direct du management sur les prises en charge des patients. Le thème autour duquel vous avez choisi de vous rassembler cette année recouvre tous ces enjeux, puisqu'il s'agit d'agir pour améliorer la santé de tous. Je terminerai en saluant le fait que vous ayez, dans chacun de vos axes de travail, mis en valeur la nécessité d'adopter une approche globale, aussi dite One Health, de ces sujets en reconnaissant que les enjeux en matière de santé sont profondément liés à des facteurs environnementaux, économiques et sociaux. Je ne serai pas plus long afin de laisser sans plus tarder place à vos travaux et à vos échanges. Je vous souhaite un excellent congrès et je vous remercie.
I'd like to thank the French Health Minister, Monsieur Yannick Noder. And now I'm very pleased to invite Professeur Isabelle Richard, the Director of l'École des Hautes Études en Santé Publique, EHESP. Isabelle, you have the stage.
So, Mr. Minister Yannick Noder, despite the distance, Mr. the Deputy Mayor in charge of Health Affairs, representing the Mayor, Natalia Perret, dear Yannick Nadezan, Mr. Vice Director of Human Resources at the Directorate for Health System, dear Romain Béguet, Mr. President of the European Health Management Association, dear Anthony Peris-Grao, dear colleagues, and most important, dear friends. We are extremely proud to welcome the EHMA 2025 conference at the École des Hautes Études en Santé Publique, taking action to improve health for all. While writing this speech, I reflected that this maxim could in fact be that of our school, as it represents us so much. You are here, and for a few days in Rennes, in the heart of one of the most touristic regions of France, and in a higher education establishment exclusively dedicated to the training of professionals in the field of public health and health management, mainly for the public sector. Our objective every day, in both our research and our training activities, is precisely to improve health for all, which means both improve health and decrease health inequalities. We warmly thank the board for the trust placed in us and the decision to host this conference here. And I would like to thank the entire EHMA team who have supported us since the Bucharest conference, both in building the scientific program and in anticipating, or at least I hope so, all the logistical issues essential to a successful conference. I would also like to thank very warmly our local organizing team, Catherine Keller, who was the pilot of this wonderful project, and all the colleagues who put all their energy in this event and are committed to giving you a welcome that reflects our value of hospitality. Welcoming EHMA 2025 to our school is very important to us for at least 3 reasons. There could be, in fact, 20 reasons, but I've chosen just 3. First, it demonstrates our commitment to Europe, whose star-spangled banner flies at the entrance of our school. Europe is a political project, a societal project, at the heart of which lies a commitment to solidarity, to a social model expressed differently in our different countries, but sharing the same idea that healthcare cannot be a commercial service like any other. It seems to me that this idea also lies at the heart of the mission of EHMA and justifies the need for specific knowledge for healthcare management, which is not simply the application of management to healthcare. It also demonstrates our commitment to knowledge, to a rational approach to the problems encountered, to the importance of facts, and to the value of public policies based on these facts. Finally, such meetings also highlight the importance of exchanges, the circulation of ideas between countries, and the interest of comparing our practices, building on our successes, and also sharing our difficulties. I very much hope that beyond this conference, the meetings held here will have an impact, and I hope that each of you, in a month or in 10 years, discussing an innovation, a success, a transformation, will be able to say, I remember that idea came while having coffee, talking with Anthony, John, Peter, Maya, Olaf, Catherine, Alexander, Sofia, Aisling, Giorgio. I must confess that I got that set of names from a prompt asking for a set of names from European countries, and obviously I should have asked for a set of names all over the world, but I hadn't foreseen the success that we would have in attracting colleagues from all over the world. So I really hope that these discussions will be fruitful and that you will bring home a set of ideas that will help you and transform your own health system. I wish you an excellent conference.
Thank you so much, Isabel. And I must confess too, we are also very grateful to the city of Rennes. The mayor of the city of Rennes is Madame Nathalie Appéré, and today I'm very delighted to invite Monsieur Yannick Nadezan. Monsieur Yannick Nadezan is health advisor for the mayor. Please, Mr. Nadezan, the floor is yours.
Ladies and gentlemen, just a few words to welcome you, all of you here in Rennes. It's a pleasure and an honor to receive the participants of the EHMA conference in our city, and I want to thank the organizer to their work in such organization. We all know how much work it is to coordinate an international event like this. I'm sure that this work will be appreciated by all the participants who, thanks to this meeting, are able to share data and perhaps to make new projects and start new collaboration. I'm very pleased to see that in our city, the scientific community is pretty active in organizing meetings, and we are glad to financially support almost 100 meetings or workshops every year. It's important for us because it's also a way of supporting science. We know that smart and innovative ideas sometimes emerge during meetings and get materialized then in the labs. And I must say that we do consider our university and especially our health campus led by the École des Hautes Études en Santé Publique as a great opportunity for our city. All of this is also important because, as you know, supporting science or not has become a great political issue. And after all, it is a democratic issue. Be sure in Rennes we do promote science. Let's make science great again. I want to thank you for the choice of the subject of this conference, taking action to improve health for all, which sounds like a political aim that we share as a healthy city which promotes social progress. As you may know, Rennes holds the presidency of the French network of healthy cities of the WHO, and our definition of health is the one contained in the Almaty Declaration of 1978. Health is a state of complete physical, mental, and social well-being, and does not consist only in the absence of disease or infirmity. It is a fundamental right of every human being. Scientific literature indicates that 70% of an individual's health status is explained by the social living conditions and the environment in which they evolve. Cities are therefore a wonderful level to act on health, since their competencies are linked to major health determinants. I'll only mention 5 examples we do experience in Rennes and the metropolis. First, with the implementation of the second subway line and the entire redeployment of the buses lines that accompanied it, we have reduced the number of trips in cars using unleaded or diesel by nearly 100,000 each day in our city. Second, with the health checkup that our child health service conducts for all 3 to 4 years old children enrolled in this city, we are taking strong action for the early detection of health problems in a preventive manner. Third, with the development of health centers, we are taking concrete action to improve the presence of a comprehensive and accessible primary care service in the neighborhoods that are the least well-served, and in general, those that also have the least favorable individual health situations and the lowest rates of utilizations of health resources. By linking the deployment of these healthcare services to health promotion and mediation activities, we are therefore taking concrete actions to reduce social and territorial health inequalities. Fourth, with the deployment of free, organic, and local food baskets for pregnant women, we are addressing the important health determinant of nutrition within the framework of the first 1,000 days of a child's life, which will have an impact on their health for the rest of their life. Fifth, with the decision to make the construction of balconies or small gardens for every new housing and unit delivered in the 43 municipalities of the metropolitan area, we are acting for well-being and mental health by learning from the lessons of what COVID and its lockdown periods were. To conclude, while I know that ideas and initiatives will be abound during this conference, and as we celebrate this year in France the 80th anniversary of our great Sécurité sociale integrating our healthcare service, which has been a significant social achievement for taking action to improve health for all, yet has been so undermined in recent years, I would like us to collectively consider the following question. Since social and environmental living conditions encompass the main determinants of health, should we not question our economic system itself, which prioritizes the pursuit of profit in many cases against social and environmental quality of life, to build a new model with the pursuit of social and environmental quality as a means to create wealth instead? Thank you for your attention. I wish you productive work and an excellent stay in our beautiful city of Rennes.
Thank you, Mr. Nadezan. And last but not least, I will invite Monsieur Romain Béguier, who is a Deputy Director at Human Resources of the French Health Minister. Mr. Béguier, please, the floor is yours.
Dear President, dear Director, dear Deputy Mayor of Rennes, dear colleagues and friends, ladies and gentlemen, it is a real pleasure and an honor to be with you today for the opening ceremony of the European Health Management Association Conference. As the Minister for Health and Access to Care mentioned in his video message, France is truly proud to host this year's EHMA conference. I would also like to express my heartfelt thanks to the EHMA board, the EHMA team, and to the French School of Public Health for generously hosting this conference here in Rennes over the next 3 days. This conference should allow us to draw inspiration from one another's experiences. So, if you'll allow me, I'd like to share with you some key features of the French healthcare system, along with a few current topics and challenges. One of the unique features of the French healthcare system is that most people working in the public sector are civil servants. Today, 1.21 million people are employed in the hospital civil service. Hospital directors in France are not typically doctors. This is a distinct professional path, and all directors receive their training right here at the very school hosting us for this event. At the heart of the French healthcare system lies a fundamental principle: national solidarity. Everyone contributes according to their means and receives care according to their needs. The system is primarily funded by Social Security through a national health insurance, which covers most healthcare costs: doctor visits, hospital stays, medications, and paramedical care. Any remaining expenses are often covered by supplementary health insurance, usually provided by employers. According to the OECD, France ranks among the top 3 countries with the lowest out-of-pocket healthcare expenses. In 2022, this amounted to just 9.2% of total healthcare costs. Our system is built on 3 pillars: independent health professionals, whose fees are regulated by national health insurance; public hospitals, which provide 66% of hospital beds; and private hospitals, accounting for the remaining 34%. Of course, we are facing some significant challenges. The aging population is increasing demand, especially for chronic care. There is also a real concern about the uneven geographical distribution of healthcare professionals, particularly doctors. Recruitment difficulties across the healthcare sector are another major issue, one that was exacerbated by the COVID crisis. Financial deficits in hospitals, made worse by inflation, are also placing growing pressure on the system. The pandemic revealed both the resilience and the fragility of our healthcare system. To address these issues, we are implementing a series of reforms. Our goal is to preserve the universality and quality of our healthcare system, while adapting it to changing demographics, technology, and economic realities. We are working to reshape the roles of different professions within the system. In 2023, the government launched a major reform of the nursing profession. A new law, soon to be passed by Parliament, will expand nurses' responsibilities to align with evolving practices and the growing shift toward home-based care. Nurse education has also been redesigned to place greater emphasis on prevention and mental health. We are also facing a shortage of doctors, a result of insufficient training capacity in previous decades. To correct this, we have been significantly increasing medical training in recent years. And just recently, Minister Yannick Noder announced a major reform to facilitate access to the medical studies. Finally, we want to reaffirm France's commitment to health at both the European and global levels. France coordinates 8 European reference networks for rare diseases and rare adult solid cancers to improve diagnosis, treatment, and research collaboration across member states. We are actively involved in the development of the European health data space and joint European procurement policies for medicines. We also support international hospital partnerships through the International Hospital Cooperation Initiative, a call for projects launched by the Ministry to foster collaboration between healthcare institutions, particularly in regions affected by conflict around the world. France is strongly committed to the international partnership for the training of healthcare professionals, as illustrated by the opening of the World Health Organization Academy in Lyon in December 2024. We need spaces where international cooperation in health can truly come to life. And that is exactly what the EHMA conference offers. We are proud to be hosting it this year. All our health systems, I believe, are facing similar challenges. Human resources are central to meeting them. This conference is a unique opportunity for us to share experiences and inspire one another with practical solutions. On behalf of the Ministry for Health and Access to Care, I would like to extend a very warm welcome to all of you. I hope this conference will be a valuable opportunity for us to share experiences, exchange best practices, and learn from one another, all in the pursuit of improving health for everyone. Thank you.
Thank you so much, Mr. Begui. As a master of ceremony, once again, I would like to thank you, all of you, our speakers, our attendees, to be here with us today. I warmly invite you to take a great advantage of the many sessions of the program to discover the various topics of this conference and to connect to each other. As you may know, this conference is a very great opportunity to get in touch with people across Europe. Actually, I've seen many new connections and partnerships forged during former conferences of the years. I invite you also to share your comments, your opinion, your ideas using the hashtag EHMA, and we will welcome them, of course, and share them. As a gentle reminder, I would like to point out that the first round of parallel sessions starts at 11 o'clock, and you can check the program on the EHMA map or on the printed program you have all in your bag. Finally, I would like to wish all of you a fantastic conference, and let's enjoy together EHMA 2025.